So like I mentioned before, you had like 10 brain surgery. So like I don't need a medical degree to know that there's something wrong with you. But is it to remove the stenosis, or did you just want to go for like the record, or you just wanted more attention and gifts, and maybe you'll get an iPad the next time you get surgery?
Well, I really did want to go for the record. I mean, I am the heavyweight champ in the ICU Hall of Fame. Yeah, it's true. She starts listing off all these other things, and we start talking about like the eye inflammation I get, which I thought was just for my pressures being high, and everything fit. And that was kind of the aha moment. We need you to throw up as much blood as you can and spit it into this suction. Otherwise, you are going to die.
How did it feel to be dead? Well, I recommend to stop dying first. The information in the podcast is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Please talk to a medical professional before doing anything that may impact your health. Hello, welcome to the podcast to Mike on Joey Such. I am Joey Such. I'll be giving my mic to Jennifer Roman. She is diagnosed with idiopathic intracranial hypertension when there's pressure in the brain. Her body produces too much spinal fluid, or also called stenosis, and the body can't remove it fast enough. Somewhere in her life, she needed 10 brain surgery. I wish it could say that. It's a typo, but it's not. Also has Behçet disease, where there's inflammation in the blood vessel. She also has PEMDAS, which stands for please excuse my dope ass swag. So we got a huge handful today. How are you today?
I am doing awesome. How are you?
I'm great. I'm excited to do this.
That intro was everything.
I gotta let the audience know what they're in for, you know?
I mean, yeah, they need to know what's up. So I mean, now they're ready.
I don't know. I feel like a lot of them did exit out of it already. So
yeah, it's possible. I feel like as soon as they heard "please excuse my dope ass swag," they're like, "Nah, fam, we're not on
so.
We need to excuse ourselves."
Yeah, so hello to whoever decided to stay behind. Okay, so
we're sorry. We apologize.
I'll try to get a better guess next time. But okay, so according to my FBI research, you were a firewoman, so you're always used to dealing with hot things.
Yes.
Then all of a sudden you went blind, and then you went to the ophthalmologist, I think that's how you say it, and diagnosed with idiopathic intracranial hypertension. Do you think it was because you were around the fire? Because like, when you were boiling water in a pot, then it reaches the edge and you're like, oh shit, and it boils over. Or if you turn off the fire and it goes down like 3 inches, could it be just that?
I mean, it's possible, but I just was fired. Not no. So honestly, it's funny that you should ask me that, because one of the biggest things that I ended up finding out is that, with my condition, I actually have this heat intolerance. Like, I just thought I sucked. Like, I just thought I was really bad at firefighting. Like, I just thought, hey, like, maybe I shouldn't be doing this job though. And no, it actually turned out that, like, with me having like the secret vasculitis thing going on top, like, I probably shouldn't have been able to graduate the fire academy the way I did. And I'm still surprised I was able to kind of physically withstand it. Because when we did live burns, the amount of pressure that is actually put into the building from the fire and the smoke, it's really enough to make me very sick. And so with me already having pressure in my brain and having all the things that I had going on physiologically beneath the surface, I'm still insanely proud that I was able to do it. I miss it a lot, but it's one of those things where now that I have a shunt and I can't, exceed a certain amount lift wise, I can't be pulling fully grown men out of burning buildings anymore. So.
Well, I was not expecting that kind of answer. Okay.
Yeah, right.
Wow, how was was it? Is it difficult to be a woman as a firefighter?
Oh, absolutely. And I feel like a lot of people, when they saw me, especially like even in EMS too, because I mean, both of these careers are very male dominated. And like emergency services is difficult as it is. As a woman, especially being a woman who likes to do my hair and likes wearing makeup, like people will automatically be like, oh, she's that girl. Like, oh, she's the ditzy one. And it's just like, no, I can still kick your ass. I'm just gonna look good doing it. Like, like I'm still, it's funny because I feel like I'm very much like a bro kind of girl, except I just wear fake eyelashes.
I mean, that's
Yeah.
well, I would think it's harder for a fireman just because you have to like lift stuff and like carry people, but like EMT,
And I'm short.
yeah, but like EMT is not like a physically labor job.
Oh, it is. Very big misconception. So like a lot of people assume that like EMTs are the ambulance drivers, that we just drive people, that's it. But like literally that job, I would say, was more physical to a certain extent. Oh my God, yeah. Because I mean, we are responsible not only for treating our patients, but we also have to go get them. Like if we have a patient who's collapsed somewhere, like that is on my 5'0" 140 some pound ass to go get them and lift them onto a gurney and get them where we gotta go. I mean, there's a rescue aspect to it. And sometimes, you do need to call in the big guns and call in like the big firefighter guys, and they'll come in and help you out a little bit. But, most of the case, like it's on you. And sometimes you don't have the time to wait for somebody bigger than you to, come muscle it out. So like in a lot of the cases, like you really just kind of have to dig deep and make it happen. Like Mighty Mouse to the rescue.
Oh my God, that sounds exhausting.
Yeah, there were a couple in particular. Like, do you watch Hoarders?
I do not.
Such a great way to open this. Okay, well, there was a case where we had a woman who basically had a lot of stuff, more stuff than you can possibly imagine. Just like basically a mansion of stuff, and she was collapsed somewhere in that stuff, and we had to climb through a window, the only open space at all in this place. Oh my
God.
Find her in 90-degree heat with no air conditioning. Yeah.
So what happened?
I mean, we were able to get her. She was good. Everything was fine, but like, good Lord, I needed a nap. I needed a very long nap. I did get my nap.
Okay, so let's go back to you. So how was that whole experience? Like, I'm assuming when you went blind for the first time, I feel like that's when everything went downhill for you.
Yeah. So like I had been having migraines on and off. All of my coworkers just thought I was being a dramatic woman and oh, here she goes again, girl. Like all my EMT friends, who were like, oh, there's nothing wrong with you. And so like it was just a typical day. I had started a new job. I was at a brand new station. They had already been losing their faith in me. And it was my first day to finally be allowed to drive their trucks.
Wow. Is that like a big deal or like a...
Yes. Like when you're a new EMT in a new station, like typically it takes a certain amount of time before you're allowed to, start actually driving their vehicles. You're kind of on probation. They don't trust you. They shouldn't. But essentially it's these very, very nice, shiny new ambulances. And I was really excited about it. But I went on break with my partner and we went to McDonald's because we're EMTs and we're poor and that's how life is. And
they don't get paid well.
No, I got paid like what, $10 an hour? But
for like how much risk
it was
you're
like,
putting yourself in and how important you are. You get paid shit.
You should tell them that. But yeah, like I realized while I was standing in line, I was like, I just want some chicken nuggets though, but I just wanted to see the varieties. I'm like reading the menu. I'm trying to get an idea and I can't read. And I'm like, wait, why can't I read? I can always read menus. Mm-hmm. This is bull. So I start, saying like, I'm like, yo, man, like, I can't read. Like, there's a problem. Like, I think like my vision's going. And he's like, what? What do you mean? Can it do that? And so at this point, it's completely blurring out. I'm screwed. I'm trying not to panic in a McDonald's. So I did what any normal person would do, and I called my mother. And, she's a nurse. But, so she immediately got me an appointment, like an emergency appointment with my ophthalmologist. She checked me and she was like, hey, you're in full papilledema. Your optic nerves are very swollen. You are going to go blind if you don't get immediate treatment. You need to go to the ER now. So I'm like,
I'm surprised you didn't go there like first.
I wasn't sure if it will. You see, there's a specific thing you have to follow with any kind of visual protocol. They need to make sure there's not like a detached retina. If it was something that was more of an ocular specialty, I would have needed to go directly to Wills Eye Hospital in Philly. And that's the specific protocol that you want to follow. So if I had gone to the ER, it would have actually taken longer to diagnose the problem because they're not going to automatically. Yeah, exactly. And then I would have been in the wrong place. And then they would have had to order an ambulance to transfer me. And then we're just wasting more time. And that's like kind of one of the cool things that, going into this, being an EMT and kind of knowing the protocols based on patients' chief complaints of what you're supposed to do, that actually helped out a lot in my journey. And I feel like that's, something that I would have really struggled without. But at any rate, I get to the hospital. They automatically assume that, I have multiple sclerosis. Like that's their first thing that they're thinking. They're like, well, this kind of looks more like optic neuritis to us. We don't know. And my ophthalmologist, before I left, she was like, this really looks like this rare disease pseudotumor cerebri, which is also known as idiopathic intracranial hypertension. That's kind of the older name that people used to use, and I'll actually explain why. When she told us that name, we were like, well, that doesn't sound that bad. It's a fake tumor. It's whatever. Like, this isn't a big deal. And we found out very quickly that was not the case and that this condition is actually insanely dangerous. And, unfortunately, after the hospital kind of realized their mistake, they had already given me steroids. They had started me on steroid treatment for the MS, which is the worst thing you can do with IIH because any kind of steroid actually increases your intracranial hypertension. So like that's just going to automatically, make things worse. And I went into a TIA and I actually...
What's a TIA?
Stroke. It's a mini stroke. So basically it's all the effects of a typical stroke, except the symptoms are only temporary. You're not going to have long-standing damage. You might have a little bit of, like nerve damage in the face, which is what I ended up with, but it's not going to be as evident as what you would see in a full ischemic attack. So basically they saw the effects of the mini stroke and, they panicked. They pulled a spinal tap on me, saw that my pressure was high, and said, oh shit, we're dealing with IIH. We now have to fly you to this other hospital in, the next state over, and hopefully they'll be able to place a shunt. And, I had heard of shunts. I hadn't really seen them a lot yet in my work. My grandmother had one and had a really, really hard time with it. So I was already,
Wait, what is that?
So basically a VP shunt. So it's a ventriculoperitoneal shunt. So basically it starts up in this section, actually works its way down my neck, through my collarbone, and actually has a little catheter and a valve that suctions the fluid and actually drains it into my peritoneum where it can dissolve properly. So it gives back that channel for the CSF to actually travel through, since I have the stenosis, and it makes that so difficult.
Wait, so it's on the outside or on the inside?
It's on the inside. So this is actually inside of my brain. It's just under my skin. So the valve actually starts in the cisterns where the CSF is. and actually drains that slowly through, and it stays on a fixed pressure that they use magnets to fine tune. So my shunt is adjustable. And
but where does it like drain to though?
it drains into my stomach, into my peritoneum.
Oh, and then your body just naturally removes it?
Exactly.
Oh.
So like that is how that works. And unfortunately, shunts can be very finicky. They can sometimes change their pressure settings. There have been a lot of issues, especially since it's magnetic. You'll see people where they'll go through airport security and like, you know, their shunt settings will change, or they'll go on a roller coaster that has magnetic brakes and their settings will change. And more recently with the iPhone 12s that have the magnets on the back, that can actually change settings too. So, you know, like it's a very outdated medical device, which has been actually one of the most significant points of everything I've been through. A majority of my surgeries happened as a result of, you know, my shunt having problems. You know, a majority of shunts will actually fail within the first year. And they're, you know, trying to do more research and, you know, see what they can do in terms of, you know, human use devices and how can we create something that's a little more user friendly, that's a little less invasive, and
Wait, so,
is going to have.
Let's go backwards. So is it like a full on surgery to get it inputted, or is it like
it's like a good like 2-3 hour procedure?
And then you get it.
And they actually had to do 3 different incisions. So they had to go into my brain, into my neck, and into my stomach to place it.
And then it like starts working. Like, how do you know it's like working, or like how do
you know the moment you wake up? Because literally your headache goes away, and you know the minute it stops working, because then you feel like crap. Like you literally will feel an instant difference, and they're able to actually, you know, check your pressures. They're able to, sometimes they'll place a monitor so they can actually see what your pressures are doing. They can actually check the patency by injecting radio trace dye and watching it travel through. So there are many different things that they can do to ensure that it works. Unfortunately, though, since my doctors are a couple states away, you know, it's not something where they have their eyes on me at all times. So if I'm away from them for 6 months and I start feeling like crap, you know, you have to wonder why. And things can get really complicated. I mean, a normal headache in somebody else, they just need to lay down, take an ibuprofen and chill. For me, that can be a sign that my shunt's malfunctioning and that I desperately need help. Like now.
So it's not like a headache you can know for sure.
Exactly. Like I've noticed for me that sometimes I'm able to tell the difference, but it's been so long since I've had a normal headache that I don't know if I would know what that feels like anymore. Like for me, I have high pressure headaches and low pressure headaches. And the only way that you're really able to tell the difference between the two is one feels like you're underwater, and that's the high pressure ones. It's just everything just kind of feels like you're in a Shark Tank in SeaWorld, and you're just kind of like on the outside looking in. And then, you know, you have your low pressure headaches, which if you sit down, you feel like absolute crap. And then if you lay down, you feel infinitely better. They're completely positional. And, you know, it's the kind of thing you'll see if you ever had a spinal tap, or if anyone listening's ever had a spinal tap, they'll always tell you like, hey, you need to lay down for a certain amount of hours. If you sit up, you're going to feel like crap, because we just drained your CSF, and, you know, that's the kind of pain that you're going to have. And if you have a CSF leak, that's the same kind of headache.
So I'm assuming that you have to go to a different stage because the specialists are there.
There are, unfortunately, no decent specialists in my state. And that's not like a dig at any of them. No, but I tried to go to like what the premier neurological institute in my state was. They took one look at my case and said, no, we can't do this. This is too complicated. We don't want to touch this.
Yeah, that's how I felt when I looked in your profile. Like, nope. And then
I feel like that's what most doctors doctors feel like getting a new doctor is like really hard. It's kind of like trying to go on a date because like everybody sees like your stuff. They're like, no.
Exactly. Yeah.
They're just like, this is too much baggage for me, and I'm like, I'm sorry. But yeah, like
what kind of specialist do you have to go to?
All right, so I needed a neurosurgeon, like right off the point. I also needed a neuro-ophthalmologist. So this is someone that deals specifically with the optic nerves and how, cerebrospinal fluid can influx with that and how, the two interact. And, really I needed a cerebrospinal fluid disorders clinic. That was the number one thing that I needed, and that didn't exist at all in my state. I feel like a lot of times New Jersey's really, really far behind. Like I always see these commercials for our local hospitals where they're like, we're getting better. And, like we're really competitive now. And we have all these new toys and all these new equipment. I'm just like, none of this is helping me.
So where is your headquarters, I guess?
Okay. So I have two now. So my main HQ is Johns Hopkins in Baltimore, Maryland, the best of the best. And I also go to NYU in New York City, both of which are fantastic. I love both teams. They've been insanely good to me. I can't say enough good things about them.
Okay, yeah, I'm very close to NYU, so I'm wondering if we ever crossed paths before.
We probably have, because like I started going there more recently because I needed a rheumatologist, and there are none. Like I needed a rheumatologist that was comfortable with vasculitis. And when I was I called every single one in the state of New Jersey, and most of them didn't take my insurance. And then the other half of them were like, we've never heard of this condition. We don't feel comfortable treating. If you come here, it'll be a waste of time. I'm just like,
would it be insane if we had the same doctor?
Who do you have?
I don't know his name, but he's on like 38th Street.
I think I might be on the same as you. Mine is Dr. Solitar, and I like love him.
Was he like Indian-ish?
No.
Darker skin, I think, something like that. I haven't seen him in a long time, so I don't remember. Yeah,
Solitar has been like probably one of the nicest doctors I've had. Literally, he knew right off the bat, like within our first meeting, he's like, yeah, I feel comfortable diagnosing you with Behçet's. Everything makes sense. Cause like I kind of over prepare when it comes to doctor's appointments because I've been treated like crap so many times because,
course,
well, it's like also having a brain condition on top, like as a patient, you're already going to get nervous, like when you're trying to tell your entire, medical journey to a doctor, and, like they'll literally sit here and be like, how did you get here? And you're like, this is a story. Like, are you sure that you want me to like give you a whole hour of just all of this? And then they'll be like, oh, wait. And then like, they'll like try to slow you down. They throw you off. So like I got into a habit of, like really documenting my case and making sure I was taking notes. And, I was taking pictures if I had, symptoms that were there one day and subsided the next. So I really brought my A game with this guy, and basically brought him just a whole manila envelope of my medical case.
Yeah, I mean, it depends on the doctor. Some are very willing to like help and like listen and understand. Others are just like shit. They're not even in the room with you for 2 minutes.
Yeah, and then others, I think one of the biggest problems I had was like they don't like it. Oh no! And then there's the dog. She doesn't like it either, but they don't like it when you're trying to tell them what you think is wrong. But they really don't like it when you speak medical to them. I've noticed they tend to think that, it comes off in a certain way to them. And I've had doctors be like, well, like, what are you? Like, what license do you have? And it's
my rheumatologist is named Jonathan Samuels.
Oh, okay. I think he was one of the ones I was considering. So I was like trying to like go through and like pick somebody. And then like I had a list of names and I gave them off. I was like, hey, which one of these is free? Just like, let me know. This is my
Mhm.
short list.
Yeah. I mean, if you need a new one, I recommend him. He was really nice.
So far Solitar has been taking really good care of me. I've been pretty thrilled with him. I know he wants me to do another consult with. They have like a guy who specifically handles, neurological rheumatological conditions, because they think that, not only do I have this rare vascular condition, but they also think it's an even more rare form of it, which would be the neurological variant, Behçet's, which would be the catalyst for everything I've had happen. And, like my neurosurgeon's been concurring really with this idea. And essentially with where we're at with it, we need this one guy who does this one specific subset of this condition to look at this and go, okay, I agree. This is the direction we should take. Because unfortunately, when it comes to treating this condition with the biologics and the fact that I have the increased intracranial, pressure, it can make it very difficult and it can make it very dangerous. And if we choose the wrong biologic, the results can actually be fatal if we don't fine tune and know exactly what we're doing. And, like with biologics, when you're making injections, when you're doing anything intravenously, it's not something that you can easily undo. So, there's a lot to really take into consideration. So we're hoping that we're going to be able to consult soon and get everything completely figured out and, get on the proper path to treatment, since Otezla is helpful, but it doesn't do everything.
Well, I'm just confused. Like, you're diagnosed with the hypertension, but like, isn't it easy treatment? Like, you keep saying you're still discovering a treatment. Like, isn't the stent good enough? Like, I'm confused with that.
So the stent wasn't good enough in the first place because I had too much pressure. There was too much. It wasn't a mild fix. And we were trying to figure out at the time why my veins were not structurally sound and why there kept being this fluctuation and these collapses. And like I said, what we did not know at the time was that with me having Behçet's, which I was just diagnosed with, like this was freshly diagnosed, the inflammation actually increases the intracranial pressure. So the more inflamed I am, the more CSF I'm going to have built up. And the more my veins are going to vasoconstrict and vasodilate. And that's going to make it harder for anything that they have structurally to actually function. And, with a shunt, you can only tweak settings so many times. And every time you change shunt settings, it can still be dangerous because if, your pressure is too high, you're still going to have your symptomology. But if your pressure is too low and you're pulling too much CSF off, you can go into any kind of brain bleed. The low pressure headaches, all those things that I was talking about when you're having a CSF leak, you're basically looking at risks of Chiari, a number of things. So, being able to find this underlying condition, we always wondered at first, if the shunt wasn't structurally sound, if it was the device, if that was the problem. And my surgeon kept assuring me, I've been in there multiple times. I was able to fix the things that were broken. I was able to fix the things that weren't working and replace the things that we needed to replace. But, I think at this point, there is an outlying factor that we haven't considered. And I wonder if there's not an underlying condition that is causing your pressures to fluctuate. And that's why we can't find a setting for you that works. So that's when the journey began to find this mystery diagnosis. And, we wondered if it was lupus. We wondered, if it was Crohn's, because I was having gastrointestinal symptoms too. And it took a good 5, almost maybe 6 years for us to figure it out. It was something as stupid as my gastroenterologist saying, your pathology from your colonoscopy doesn't fully fit Crohn's, but there's this one random disease I remember learning about, like way back when I was a med student. And I got to ask you a question. I'm like, what is it? She's like, do you ever get oral ulcers? And I was like, yeah, all the time. But I just figured, I used to have braces as a kid. I don't really get bothered by it. It's one of those out of sight, out of mind. And she was like, she starts listing off all these other things. And, you know, we start talking about like the eye inflammation I get, which I thought was just from my pressures being high, and everything fit. And that was kind of the aha moment. And, you know, I also had like this weird livedo reticularis, which is like this purple lace rash that I get on my hands. And, you know, typically it's something that you can see in autoimmune disorders when someone's cold, but I get it all the time. And that was another big, you know, clue into what was happening. And so our thesis is, like our full hypothesis that we're going off of, is if we treat the Behçets, if we get the Behçets under control, then we'll be able to properly manage the intracranial pressures. We'll be able to fine tune the shunt to a proper setting, and I can hopefully live a normal life. You know, God willing, the other complications and all the other things that happened as a result of, you know, and all these surgeries and everything else doesn't, you know, come into play.
That's insane. But like, so like I mentioned before, you had like 10 brain surgery. So like, I don't need a medical degree to know that there's something wrong with you. But is it to remove the stenosis, or did you just want to go for like the record, or you just wanted more attention and give, so maybe you'll get an iPad the next time you get surgery?
Well, you know, I really did want to go for the record. I mean, I am the heavyweight champ in the ICU Hall of Fame. Yeah, it's true. But
double digits,
no.
baby.
You're right. No, so all right. 2 of those surgeries, I'm going to basically just list off everything we've had done here. So 2 of those surgeries are attributed to the stents that I had placed. I tried one, it didn't work. I tried a second one for good luck. That didn't work either. So then I had to do a diagnostic procedure known as an ICP bolt. Now, what that does is it actually, they drill a burr hole into the skull. They put this little catheter in, and for 3 days, yes, 3, with a hole in your head, they monitor your pressures. So they can see what's going on. They can make a determination of, is this person a good candidate for a shunt? And if we shunt them, what pressure should we put them on in terms of what their pressures do during their waking hours, their sleeping hours, versus when they're standing up, laying down, anything like that. So it gives them a better idea of what they do. Since, you know, a spinal tap is kind of a snapshot in time, it doesn't really give you the full picture. So I had to do that procedure 3 times. The other 5 surgeries were my initial shunt placement, so I could actually have the fluid drain appropriately. So I would actually have an open channel for my CSF to communicate and not, you know, give me the crazy headaches and blindness that I was dealing with. And unfortunately, you know, with shunts, there are complications. My first procedure, my shunt broke, I want to say about a month after it actually malfunctioned, and I had yeah, and I had to have it replaced. So that was surgery 2. Now, surgery 3, 4, and 5 were a little more complicated than that. So essentially, like, I had these 3 back-to-back where literally everything that could go wrong did go wrong, and we didn't expect for any of it to happen. It's possible that the condition that I had played a big role. But I ended up having a cyst that formed in a position that was inoperable, and it basically grew several sizes too big overnight. And they were like, hey, we know we just did this surgery to try and fix your shunt, but you know, there's this cyst, and we know there's a big risk, but we have to, you know, go try to fenestrate it and drain it and see what we can do with it. And so we did that. And then unfortunately, after that, I suffered a bleed, and my brain actually suffered a 4 millimeter midline shift and actually went off kilter. And I was very, very sick. And I did manage to come out of it, obviously, but it was one of those situations that I probably shouldn't have been able to come out of so easily. And, you know, like it was definitely a much more difficult time for me. And it was a really traumatic experience for me because like I was afraid to sleep, and it made me afraid to sleep for like a while. And my mom would actually, keep watch on me and, monitor my vitals so I could sleep. And, so being able to come out of that was huge. But with that being said, there are a lot of, complications that can happen, when someone has many, many brain surgeries.
Mm-hmm.
So, you have concerns of Parkinson's, and
I'm assuming it's always in the same place, right?
Yeah, always. And it actually got to a point where they needed to stop drilling holes in the same spot because I was starting to kind of cave in a little bit, and they had to start going on the left. So I've actually had surgery in many, many parts of my skull. And it was actually really, really hard, being a girl. Cause like I really loved my hair, and like they would hack it off, like shamelessly, brutally hack it off, shave it off. And I had such a hard time with it at first. And, so it took a lot for me to kind of get over the vanity issue. And a lot of people would be like, oh, like, you should be grateful to be alive and you shouldn't be complaining. And I'm just like, that doesn't take away what I feel, and it doesn't make it any less valid and any less legitimate.
Yeah, I mean, that's definitely hard. Did you just keep your hair the way it is, or did you just shave it off? And
I cut it short for a while because like I had it short at one point back when I was doing emergency services, and like I cut it probably about to here when I kept getting my shunts done and redone. But then I kind of discovered that if I kept it long, oh my God, I could flip it over to the side and that people wouldn't really be able to see if I had sutures.
mm-hmm.
So that was what I would do. But, like that kind of created some issues every once in a while. Cause like I would need to go see, pain management since I had all this nerve damage, all these surgeries, all these different things. And pain management is such a difficult thing as a patient anyway. There's so many misconceptions, and, like you deal with a lot of issues with different doctors if they don't believe you. And so I go in and, essentially I have this guy who is listening to my story, very straight-faced, not at all interested in anything that I'm saying. My mom is sitting next to me. And, he's like, well, if you had brain surgery, where's your staples? And why do you have hair?
Okay.
And I had to literally, and this is like a couple days after my surgery, mind you, like bloody staples still in place. And I actually had to lift my hair up and like show this guy because he didn't believe me.
It's terrible.
Yeah.
Jesus.
Yeah. So it's like there are a lot of misconceptions that I feel like, people deal with when you're trying your best to, cope with the insecurities that you're feeling, as you're going through your journey. And then, as you're coping with it, your coping mechanisms end up being what makes doctors feel as if they're allowed to mistreat you, as if, it's okay to treat patients a certain way and to have this level of disbelief. And like I even learned at a point like, that I couldn't even like wear makeup if I needed to go to the hospital or something like that. Like if God forbid, I was just planning on having a normal day and having my face beat to the gods and just trying to exist, and then something happened and I have to go to my local hospital, I got to wipe this stuff off because if I go in, because I pay good money for Rihanna's concealer.
Yeah, she has great makeup.
She does. And like literally, it's so good that all the nurses are like, you look healthy. It's like, I should for $45. I better look damn healthy. Very healthy glow.
This is insane, like what you have to go through. Like, I kind of understand from the doctor, they don't want to just prescribe you medicine, you can abuse it. because medicine can
Exactly.
be easily abused, but at the same time, especially if you just had surgery and you're vulnerable, and then you got prove yourself that you just had brain surgery, and it's I can imagine how I guess humiliated you were. You had
Oh
to
yeah. The worst thing is you're already being treated especially in a pain management setting. If you are young, if you do not look as though you are physically ill, doctors assume that you're there because you're pain seeking.
Mhm.
They're like, okay, you're drug seeking. That's what this is. And it didn't help that I'm heavily tattooed. I look like, you know, I have this Keith Richards thing going on, and they just don't trust me. So, I mean, I have that face that you would see on the side of a milk carton when something's wrong. So, so there's a lot of misconceptions. So I think between that and then the fact that, they literally couldn't see what was wrong with me, they just had to read it and they didn't get to watch it. They didn't get to watch me go through it. They didn't get to, see me go from having zero pain tolerance to literally learning to live with 10 out of 10 pain every day of my life as if it is the most normal thing in the world. I feel like my pain level would probably kill a normal person. So it's they don't get to see that. They don't get to see what a patient goes through. A doctor sees you for all of 30 minutes, an hour if you're lucky and they're, very personable. And then they go home, they go back to their lives, they go back to their families. That's it. I go back to being everything that I've been for the past 6 years. I go back to the pain and suffering. I go back to the worrying, the anxiety. It doesn't stop for us. It's not something we get to take a break from. There's no, little refuge point for us, it's not oh, you're feeling better. It's no, I'm just feeling a little less crappy than I felt yesterday. Whoop-de-doo.
Yeah, I mean, I totally understand where you're coming from, and I feel the same. I guess the trick is to look like shit every time you go to the hospital. Exactly. And you'll get treated a little bit better.
All right. I think once I started having significant emergencies and enough doctors had to deal with me, that's when they were oh crap, it's her, and she's gonna bring this cloud of just what the actual crap with her, and it's gonna be a night, y'all. Because this girl is gonna come in here bleeding internally and we're gonna have a party. So
do you ever
they would just
have you ever received this, I don't know if you go to emergency rooms often or not, but do you ever get the same nurse again?
Oh, all the time. All the time. I can't tell you how many people it feels like a reunion.
I know, it's hilarious. Hello again. I'm back.
Oh my God. No, at Hopkins, literally, if any of my Hopkins people tune into this, which they probably will, literally every time I go, there's this special floor for neurosurgery. It's floor 12 in Sheikh Zayed Tower, which is where I stay. It's the penthouse for neurosurgery. And I always get this really sick ass room with a view. I love it there. Granted, I hate the reason why I'm there, but it's a room with a view. You gotta like it. So every single nurse on there I know personally, and I've had a million times. So I'll show up and I feel like the governor of Johns Hopkins. It's roll out the red carpet. I'm rolling up in a wheelchair. We're hey.
It's comforting though. You're hey, I'm here again. Let's. You don't. It's a comforting. It's a family moment.
Yeah, honestly, I feel if there wasn't that sense of family that you get when you go and you see people that are familiar faces, especially in the middle of a COVID pandemic when your family members aren't really allowed to be with you. Mm-hmm. It's hard. So having familiar faces, having nurses and doctors on staff, even all right, look, I made friends in nutrition. They sneak me sodas. We're cool. Really? They get me the good stuff, not the cheap stuff. And literally we became bros. I became buddies with people in clergy. I became buddies with people in cleaning. Like, I like to talk. If you come to my room, we're gonna hang out. It's gonna be a party. We're gonna have a good time. Like, it's just how it's gonna go.
Yeah, I mean, shout out to nurses for all the shit they have to deal with.
Oh yeah,
So
absolutely.
Like, we only met like here, but like, I'm sure they appreciate people. People are there, like, not a big deal, but like they're like pleasant to work with. Like, I'm sure they get like some really shitty people.
Oh yeah. Well, I can even tell you that from the EMS side, because I've seen how nurses get treated. I've seen the situation at hand, like when things get bad and when things get busy, and when people decide, well, I don't feel good, but I don't want to wait to go to my doctor on Monday, and I want you to give me treatment now, and it's more urgent than the person who has a concussion next to me. So it's like, I've always tried to be that patient where I'm not needy. I try not to bother people because, like, I know they're dealing with so much. Like, if I press that call button, it's because I'm having an emergency and I need help. I will try to use the bathroom on my own. Thank you. Like,
and then the machine starts beeping and you're like,
oh my God. And then I'm like, go. It's like Die Hard, and I'm like, dive into the bed.
Like, I wasn't doing anything wrong. And like the wires are all tangled out.
I remember one time, like, that was the first time I found out they didn't trust me to like walk on my own. And I was like, nobody told me this. Like, literally, I got out of bed and I was like, what's that noise? Oh no, what did I do? And they're like, why are you up? And I'm like, I had to pee, I'm sorry. Oh my God. They just like come running, like, like this crazy thing's like about to go down. And I'm just like, sorry, dude. I didn't mean to.
Well, they don't know. Like, they just hear the beep and it's gotta run. Like, it could be totally serious, but could be totally stupid.
I think the best thing is when, like, every once in a while it'll happen and they'll be like, nah, man, nah, you're good. You just got me out of a bad situation. Thanks. They're like, thanks for looking out.
Yeah. I did wonder if like the nurses that like I had, like, they did come to my room to hang out. I feel like some do, but it's hard to say.
Well, we definitely would take a little bit of time when it was time for my nightly heparin injection and, glorious cocktail of pain management. So like we would make an event out of it. It was an event. And it would take about a half hour because like we would just end up talking about the most random things. Like, for instance, K-pop. We would get really into K-pop and we would just be like, oh, BTS and oh, this. And like, then all of a sudden, like, we found out that we were all fans of the same thing. I think like one time the Winter Olympics were on and I was watching figure skating, and then I found out that one of my nurses was like an ex-figure skater, and I was like, that's so dope.
Whoa.
And like we became like best friends just based off that. So it's like it's cool. But the thing I love the most about Hopkins, because it's it's a worldwide institution. You have people coming from all over the world, and all the nurses I had, a lot of them were on like the Dreamer program. They were from all over the world. So like I got to meet all these different people and different cultures, and it's just the coolest thing in the world to have like that sense of international togetherness and unity. It was just one of the coolest things, and like especially in a time when like things didn't feel united. So getting to feel that sense in a place where I was feeling really vulnerable and needed to have like a sense of family, that was just awesome.
Yeah. Shout out to nurses. I guess it's sad when you have to leave, though.
It is. I always feel like it's bittersweet because like you're relieved to lay in your own bed.
Yeah.
But at the same time,
you miss them.
Yeah. And sometimes the food.
Like you like look like I don't know what the shifts are, but I think it's 12-hour shifts, and I like looking for them to like coming to work.
Exactly. Like I would get so excited. Like if someone was like, okay, well, I'm going to be on tomorrow night. See you at 7. I'd be like, hey. They're like, I requested you. And I'm like, sweet, I requested you. Like we would like request each other. Like I would always make sure to go out of my way to like do surveys and like, put the names in for whoever did like awesome jobs. I would like literally vote for everybody. I would like write these little handwritten things, and I'll never be able to know if they could read my chicken scratch, but but literally, like, I always tried to, you know, make sure that they were getting recognition, because like just everyone that I had on my team was just so solid. And like, residents can be tough sometimes.
Yeah.
So having nurses that validate you and help you formulate your thoughts and communicate with them more effectively, I don't know what we would do without them. Like, that
definitely made the experience so much smoother for you.
Yeah.
Like 100%.
Yeah. Especially if it's someone who is not medical and they're not used to being able to, you know, giving reports to physicians, and, you know, like, there are so many things that have to be said symptomatically for a doctor to take a case seriously. So, you know, sharing those weird symptoms with your nurse and having her, you know, vouch for you and really go to bat for you, it makes a difference. And I mean, I've seen a lot of situations, I mean, even just back when I was working, where, you know, having that one good nurse really makes the difference between life and death for a patient. And it's the truth. I mean, they see things that other people don't.
Yeah, so shout out to nurses. You deserve 100% raise.
Right. They really do.
Yeah.
I feel like I always say that to them, like, every single time. And like, I'll say it when the residents or like the main doctors in the room, they're like,
I mean, I think nurses do get paid pretty well, though.
Decently enough, but it could always be better.
Yeah, I think they get paid like $70K. I mean, that's decent.
It depends on the state. Depends on the state. It depends on the hospital.
True.
It also depends on whether they're an LPN, RN, what kind of care facility they're working at. Because there are so many different intricate levels of healthcare and of different positions. And I feel like it's something a lot of people don't get to see behind the scenes unless they live with someone who is a nurse, or, you know, like, they work specifically expressly in that field. But I know, like, for me, like, watching my mom, you know, be a nurse when, like, back before she had to basically be my full-time caregiver. Hey.
Yes, I did Google it. It's $65K to $120K per year.
That's a big gap.
Yeah, but even $65K is pretty decent.
Yeah. I mean, it's better, but with the cost of living going up, that's where it can get a little tough, especially if you have kids. New Jersey, it sucks. In Jersey, like, cost of living is like crap.
Yeah, but a house costs like $2 there.
No, I wish. Oh, they're worth $2. They don't cost $2. Like, talking about like $400,000.
Well, then you gotta live in New Jersey, though. Like, who wants to live in New Jersey?
Nobody. Like, I mean, I might be, you know, living my Grace Hart from Miss Congeniality best life, but still. Like, oh God. Like, Jersey can literally go from being just a beautiful shore area to a farm to really crappy city.
Mm-hmm.
And is mostly highway. And most people know where each other live based off of what exit they're off of. It's like, oh man, like, which exit are you on? Exit 13A. It's like, oh yeah, cool. I'm like 5 exits down from you.
So we talked about Behçet disease before, and you were mentioning that it impacts everything. How does that feel for you? Like, how does the inflammation of your blood vessels feel?
Terrible. Literally, it feels like constant stabbing pain all through my veins at all times. And it's funny because, like, the thing with Behçet's is that it can affect multiple different organ systems, sometimes all at once, sometimes one at a time. And it can change through any part of, you know, disease development. So when I was having gastrointestinal symptoms and basically nothing else, you know, like, it was Behçet's, but we didn't know because it looked so much like everything else. And that's why it's so hard to diagnose, because, like, it looks like all of these other inflammatory and autoimmune conditions, but like without being able to look at the full picture and watch it develop over time, you know, like it makes it really difficult. And you know, like it is a very difficult and painful condition. I know that the Otezla that I've been placed on has actually helped a lot. I know at least now, because like doctors would treat me like I was insane when I'd be explaining the levels of pain that I was in and what I was dealing with. And I mean, now that we know basically my entire vascular system has been inflamed this whole time, I bet they feel kind of stupid. But
were you diagnosed because of all your symptoms, or were there like a test you took and then it made you official?
With Behçet's, you actually see a lot of skin lesions. They'll do something called a Pattergy test where they'll actually prick the skin, and it'll actually develop this like weird red bump and this scarring, this tissue. And I actually already had so many lesions that looked like that from just like little minor injuries to where they didn't even have to do a Pattergy. They were just like, this looks exactly like Behçet's. And I had had a couple mishaps where they were doing a radio trace dye injection into my shunt to make sure everything was, operating effectively. And when they injected the dye, my body had a weird reaction that I had never had before. And I think as my disease activity has progressed, my body's become a little less tolerant to anything that comes from the outside. And I went into just full, just livido reticularis, just full purple lace, everything, like all the way up through my chest, my back, my legs. It was so bad that they actually brought a crash cart, and they were waiting for me to literally just, I guess, drop. And I didn't. And they were very confused. I was very confused. I'm like, everyone's standing around me with paddles, like they're ready to party. And I'm just like, hey, what you got there, bud? Like, what's that? You're not going to zap me, are you? And, there was a doctor that came in. He's like, this looks like Behçet's to me. Like, what is going on? And he was just like really confused. And I was like, well, can you document that for me? Because like, we're trying to diagnose that. So if you want to like do me a solid and just, write that down. And after I saw Bruce Solitar over at NYU, he took one look at my hands, one look at the rest of me, and, looked at my eye inflammation, looked at all the skin lesions I had, and was like, yeah, this is basically a slam dunk for Behçet's. We're good. Like, we're gonna, obviously still test you for everything else, because there's no like specific blood test that you do for Behçet's because everything fluctuates so much. It's so hard to pin down. Mm-hmm. There are certain genetic predispositions that you can have, but you don't have to have those things in order to get the condition, because there are biological, events that can occur that can make it happen. And in my case, when I was 14 years old, I had this really crazy disease of unknown origin. When I was like, it literally kept me in the hospital for an entire summer. I was really sick. And they ended up coming back and saying, well, we think this might be mono, but we're not sure. But like, they were getting ready to literally admit me to the oncology ward. They thought I had leukemia. Like, I was actually having a bleeding disorder on top with this. My platelets were going down into the 50s. Like, I was very sick. And, my mom was actually getting ready to donate bone marrow to me because of how bad my platelets had gotten. And, so for them to kind of take a sharp turn and say, oh, well, maybe it's mono, because just randomly, all of a sudden I got better. Out of nowhere, I just got better. There was no rhyme, no reason, nothing that could have explained it. But, they found positive Epstein-Barr, which is a cause of Behçet's. That is one of the things that can do it. And ever since I had that, specific run-in with, Epstein-Barr, I kept getting sick with random viruses, things that people normally would be immune to, things that, I would just kind of randomly pick up like crazy, just, things from literally other countries where doctors are like, how did you get this? Like, did you go somewhere? And I'm like, no, I did not. Like, I've been here the whole time. I'm poor. I don't go anywhere. And like, they'd be like, well, you have diphtheria. And I'd be like, oh, that's great. Am I going to die? So like, it was a very normal occurrence for my mom to like have to, keep me home from school and, take me to the doctor for whatever weird ass virus I have this week. Like, I was always the sick kid. Always. Like, I always had something going on. I was always very pale, always looked a little like a vampire, always had the whole I've been indoors my whole life thing going on. Somebody get her a bubble.
So did you start the pandemic then?
Literally with the pandemic, I have not been outside of my house. I have been living confined. I have been literally just like chilling. I was quarantining before it was cool. Like before it was in vogue. I was just kind of avoiding people, doing what I do best. Antisocial social club was good. And I mean, like, I kind of want to keep social distancing after all this.
So you have a fabulous article called My True on our odyssey.org.
I do.
And you talk about getting sicker and sicker and people not believing you and disappearing when and then up for you and just your mom. I've been in a similar situation of people leaving, so I fully understand. I want to talk about your fatal complication. You were pronounced clinically dead. So what happened? Did the Reaper not want to deal with your shit for today?
Yeah, I think the devil was just like, girl, your sauna's not ready. You got to go back. He was like, send her back. So I was like, okay. It's kind of like Montero, except I went up. I went back up. They were like, no, you got to go. But yeah, so literally, I still don't know exactly how that went down. I don't think I'm ever going to know. It's actually happened twice. I only talked about the one time. It's happened twice, actually. But
how did it feel to be dead twice?
I don't know. I don't know. I mean, I've tried to treat it as a rebirth. For a while, it messed with me. Like, it like really messed with me. And like, I remember reading it in my medical documents and seeing it. And like actually seeing like an x-ray where like you could actually see like the paddles like on my chest. Like you could see where they were giving me transfusions and my body was just like not having it.
Wait, so when it said you're dead, does that mean that your heart is not beating anymore? Like what made it seem that you're dead?
I'm not sure exactly what they had put, but I believe that was the case, yeah.
That you have no heartbeat?
Yeah.
Okay.
So they had to shock me.
That's cool, I guess.
Yeah, so I guess all those kids that, like thought I was a vampire in high school, what's up?
Oh, I mean,
the dream is a reality.
And like you didn't get any of those, like, people get like the visions of like, oh, they were on the tunnel and everyone was like,
no,
here.
But I really freaked people out because like, all right, so the first time it happened, I wasn't conscious for literally anything at all. Like I had no idea it even happened. I just had a hemorrhage and that was it. And then somehow I just wasn't dead anymore. Hooray for me. But the second time it happened was a very different story. And it was a freak accident. Just complete freak accident where my tonsils started bleeding and they went to extubate me and it caused negative pressure pulmonary edema. The alveoli sacs in my lungs burst and my lungs filled with blood.
Oh, no.
And not good. So I went out, had to be shocked a few times. And basically I at some point came to, they put suction, like an actual suction tool in my hand. And they were like, hey, we need you to throw up as much blood as you can and spit it into this suction Otherwise, you are going to die.
Oh my God.
And I couldn't really process anything that was going on at first.
I thought they would just like put a tube down your throat too.
It was literally like the kind of thing that you would see like at the dentist where like they suction out the spit and everything. Like that is what I was using to suction the blood out of my own mouth and actually like spit up blood into the tube. And I actually remember the scene like very vividly. Like I had one nurse on one side, one nurse on the other, one grabbing one shoulder, one grabbing the other. And the one was trying to like tell me, she was like, by the way, she's like, you've just been through all this shit, but you still look really great. I was like,
that Rihanna makeup.
Because like I had it was one of the ICP bolts I had done. That was the surgery that I had when this happened. So mind you, I just woke up from brain surgery, throwing up blood. I just died. I'm literally spitting blood into a tube and like trying not to be in the worst pain of my life because I'm doing things that are making my pressure go up. I have this hole in my head. Like I needed it, like I needed a hole in my head, like really. And so my surgeon comes in. I'm pretty sure I gave this poor man PTSD from this exact exchange. I feel terrible that this happened. But he looks at me like he's seen a ghost. Now at this point, I haven't seen myself yet. I do not realize that I'm covered in blood. I do not realize how pale I am. I do not realize how bad I look. So that nurse lied. But I appreciate her lie. But he looks at me and he's like, how do you feel? And I'm like, well, I think I'm okay, but I need you to go check on my mom because I have this really weird feeling that she knows what's going on and I really don't want her to panic. So if you could like do me a solid and just go check on my mom, that'd be great. And he just like, nice. And he's just like looking at me. He's like, okay. And like, I was immediately placed on BiPAP because I couldn't breathe. My lungs were they kept refilling with blood. They kept trying to. So
that where they put the tube down your throat?
They had extubated me. Like I couldn't have another tube placed down my throat at that point. Like they just needed. So basically, they put a mask on and it actually forces positive pressure air into the lungs and actually provides a therapy and keeps the airway open. That way, the patient can breathe with less stress.
Yeah, so you're not breathing; it's breathing for you, for the most part.
For the most part, it's forcing air into the airway. You're doing the breathing, you're doing the physical act of it, but it's forcing the air in to make it easier to do. That way you're not putting as much stress on the body by doing everything yourself. So it's not going to be the same thing as seeing someone, who's actually intubated where the machine is breathing for them. This is just providing a positive pressure airway. Yeah. So it was difficult because with the test that they were doing, because like I said, this is a diagnostic surgery. Like I'm supposed to have this thing in for 3 days. I'm supposed to be able to change, the positions my body is in so they can check my pressures properly. And I couldn't do that. Like I was, my lungs were fried. I went home on O2. Like my lungs weren't the same for a long time. Like I really, suffered a bad injury with that. And I was really fortunate because, only, I believe the statistic is 0.1 people live through negative pressure pulmonary edema.
Oh my God.
0.1%.
Holy shit.
Yeah.
So did something go wrong or was this like a total accident? They just went into this shock, I guess?
It's possible that with the vascular structure of my body being as fragile as it is with Behçet's, that it was less of a freak accident, more of my body reacted very badly to something normal happening. Because we honestly thought at first it was a freak accident, but looking back, now knowing what we know vascularly about me and how easy it is for my body to just open up and bleed for no apparent reason, it would make sense to have that structure just burst like that. It would make perfect sense physiologically. So I think the Behçet's actually did play a role in that incident. And, it's always going to be something in the back of my mind the next time I, get intubated and have another procedure, I'm always nervous. I'm always, concerned about, because it's something that can happen with even the smallest procedure for me. Like it's always going to be a thought. And I'd actually had a surgery after. Man, did I get all kinds of panicky. They had to Behçet my ass before I went back there.
So is it like something they can like prepare for, or is it more of a gamble and they have to?
I mean, what they can do, they can try and use like a flexible tubing to try and mitigate the risk, since some of the more hard tubing can be more of a risk for someone who has a bad airway or a problem airway. So they marked me as a difficult airway from that incident forward. So I only get soft tubing placed now, but I still have a very, very fragile, vascular system. Things can still happen. Surgery is surgery. So it's always going to be a concern, at least.
So it seems that your journey is still continuing of how to, I guess, control your symptoms. And you mentioned that it might be that it could all just like go away, but it seems more that you'll be able to control it, let's say with medicine or some tools, I guess. Right?
Well, with both of these conditions, they can go into remission, but you really don't see that happen like insanely often. There's no cure for either. So, I mean, even if it does go into remission, it can always come right back. So management is really the best thing that you can do. That's why, like with the shunt, with, possible biologics, anti-inflammatory agents, obviously I can't have steroids the way, a normal person with an autoimmune condition would. So we have to, really consider our treatment path. But management has definitely been the best way, kind of looking at it from terms of how can we suppress the effects of what's going on to a comfortable level, and, trying to be very realistic about my expectations of what can I do to make my life as comfortable and as livable as I possibly can, while also understanding that it's not going to be perfect. It's, I'm not going to ever have a day where my symptoms are completely resolved. Like I'm going to be dealing with something to some extent, and, learning to be okay with that. And, I've been slowly going into the possibility of another condition. And I've been starting to deal with some tremors and having some other issues. So it's like I'm also preparing for the future of, what having these conditions mean and what possible complications I need to deal with. Because, I used to be really afraid of the future. I used to be very terrified because I've seen what can happen in a lot of these incidents. And I kind of know where a lot of it's going before it even gets there, because, I do have a medical knowledge, and, it's a very,
that helps so much.
But it can be so like anxiety inducing also, because you before anyone else does, and you try to calm yourself down and you try to kind of like, talk yourself out of it. Like for a while, I tried to convince myself that my tremors were anxiety. Like I tried so hard to convince myself of that. I knew it was a lie, but I tried to, convince myself anyway. And, it finally got to a point where I was trying to put my earrings on and my hands were just shaking so damn bad that like I missed, and I accidentally like put a second hole through my ear. And I was like, well, it's time to admit that there is a problem. Like, Jen, you gotta talk to somebody about this. So like I can still be very stubborn with these things. And like I said, like I was very scared of the future, but in my case, the future's kind of coming early. And it's really kind of forced me to shift my perspective and do things I wouldn't usually do. And even, you know, being in situations where like I've already died a couple times, like I've already, you know, dealt with things that most people at my age or even really older than me don't deal with. And, you know, like it really kind of forced me to look at my life and go, can I honestly say, like, looking at the end of this, that, you know, I have no regrets and that, you know, I'm content.
Why you don't regret doing the podcast?
Not yet. We'll see. But yeah, no, like it, the one thing I will say, for the time I was much more lucid, yes, your life does flash before your eyes.
Mm-hmm.
And actually, the brain surgery, I actually knew. The one that I said I wasn't conscious of the fact that it happened, but I knew before it happened that it would, if that makes any sense.
It does not make any sense.
So I'd already known that my chances of walking out of that surgery were very slim.
Mm-hmm.
I'd already been told and I'd already been warned. Mind you, this was a couple days before Christmas. Sorry, Mom. And literally, like, they were like, hey, you've had 2 surgeries already. We did these like back to back. Like this was in a 3-day time span. Like it was right on top of each other, which you don't really want to do, especially even just with anesthesia. When you put someone under anesthesia too many times in too short of a time, the risks become exponential for, you know, any number of things.
And then with your Behçet disease, that's even worse.
Yeah. And with the fact that I had all these complications that no one expected, because this was also another rare complication that no one expected to have happen. Mm-hmm. There was no explanation for it, just happened. And, you know, I remember going down to that room in my wheelchair and like time was going by really slowly. And I remember like going through the glass hallway and getting to the door of the surgical room that I was going into. And I always went into the same one. It was always operating room 3, always OR3. I don't know why, but so me and OR3, and they're like, okay, like we're ready for you now. And I got up, I walked into the room and I put myself on the table. Like I actually went and sat up on the table myself.
Really? I thought you'd be too lucid to. I
wasn't on meds at the time, I don't believe. I was like,
the anesthesia. Don't they give you?
They haven't started that yet. This was before they'd even hooked me up to that yet.
Oh, I thought they'd do it in like, well, and for my kid, they would do it in like the wherever you're like normally is, and then like, and then
this was an emergency procedure, so they basically pulled me down from my room in a wheelchair. Like I was already staying in the hospital, so it wasn't like I was in the surgical center, you know, like they kind of got you feeling a little twilighty, then they bring you back. Like, it wasn't that kind of deal. So like, I think that's why it sticks with me so much, was that it was so different from, you know, what I usually do. And, you know, I said goodbye to my mom. That was hard because I felt like it was the last time I was going to see her. And like I said, I walked into the room, which was like the hardest steps I've ever had to take in my life. And I sat up on the table myself. And like I said, like right before I started to kind of like drift, because like anesthesia kind of like freaks me out a little bit. I don't like that feeling of, you know, passing out. I don't like it. And like that weird taste that you get in the back of your throat, like that stuff always like freaks me out. And like I was trying to like kind of like soothe myself and calm myself down, but like my life started to like flash like right before me. And I'm like, why is this happening? What is going on? I don't need this right now. And I remember thinking, man, well, that was a letdown. I was like, really? Is that all I did? Like, is this really what it sums up to? And then I remember like the last thought I had, because like it's incredible the things that like pop through your mind and like the people that you think of, and you know, like the faces that come to mind. And I remember promising myself I would reach out to the people I thought of. And, you know, like if I managed to get through it, that I would, you know, turn things around and, you know, take it seriously. And, you know, like that was something that really stuck with me a lot, because it was that really somber knowledge that like, hey, like this might really be it.
Yeah, like life is fragile.
Yeah. Oh yeah. And I went from being someone who was a very invincible kind of person. I lived very hard in my teens and early 20s. And like I would party a lot, I would drink a lot, like I was crazy. And
now you're 40 years old.
Oh yeah. The most boring 40-year-old you'll ever meet. No, but like I lived hard, and I was like a very like risk-takey, like party kind of person. And I really thought I was invincible. And my mom would always laugh at me, and she's like, man, she's like, I was you in the 80s, and I'm telling you, you're going to hit a wall. And when you do, it's going to change you forever. She's like, it's coming. She's like, I'm telling you, she's like, you'll hit this point where you need to make a decision. And
I mean, I don't think she was expecting what you had to go through though.
No, not at all. Not at all. Like, and we've talked about it. Like my mom and I are really close. Like we have so many like deep discussions about this kind of stuff. Cause, you know, like she literally watched how much I changed as a person through the process. Mm-hmm. Cause like I went from being this like larger than life, I'm going to run into a burning building and like, screw you, screw this, screw that. Like literally just not giving a shit about anything. Mm-hmm. To, you know, I have this insane weight on my shoulders and all this responsibility in terms of, you know, my own healthcare and the people that love me, and, you know, sharing my story and, you know, making sure that I make something out of this and I make it count and I make it worth something. Because I really, at the end of the day, I want everything I've gone through to mean something. And it's funny because I feel like I could be like such a nihilistic person at times. But when it comes to like this one thing, I'm not. But, you know, so I really, my life, it didn't go the way I planned. And I've had to improvise, you know, like when I first got out of high school, I joined the Navy. That's what I wanted to do with my life. I ended up getting injured in boot camp. I was sick the entire time. My DIs hated me. Like my RDCs hated me because they were like, you're lazy. And I'm like, I'm sick. They're like, do push-ups. And I'm like, screw you. We argued a lot. And so I felt really ashamed, you know, like after I came home from boot camp, because like I talked such big shit about that. I was like, I'm going to join the Navy and I'm never going to come back here again. Screw you guys. Ha! And like, I came home and everybody's like, no, screw you. And I'm like, yeah, that's fair. So, you know, like, I always wanted these really heroic jobs. Like I really wanted to do something with my life. And I, you know, like the Navy was it at first. And then, you know, I couldn't do that. So I was like, all right, screw it. I'll, you know, be an EMT. And then I was like, this isn't, you know, exactly what I want. So let me add firefighting to the mix. And then my body was like, please stop. Please stop. And it's hard because it's like what my heart wants and what my body can do are two very different things. Mm-hmm. And living with that for me, I think has been the hardest thing. It's like a racehorse that can't run. And it can be very unfair at times because it's like, I want to do these things and I miss it so much. And like every once in a while, like I'll catch myself, you know, like putting on my old uniform just to see how it looks. And like, I like it too much. And then I want to go back and, like, but I know I can't. And like it's very challenging for me to stop. Like every once in a while, like I'll see a car accident and I'll want to go help, and something will happen and like I start running in that direction, and then I go, fuck, I can't. Like, I'm not allowed. Like, I can't do this. So it's hard. It's really hard for me.
Yes. I don't think I put in the beginning, but you do a lot of patient advocacy. Yeah. So now are you happy now with how your life turned out now?
It's been giving me a much bigger sense of fulfillment. And I like that I'm able to be there for others. That was one of the biggest things I loved in the jobs that I had before. I have terrible hero syndrome. I do. And it's a thing for me. So getting to help other people navigate this crazy ass journey, it's important to me. And, getting into the legislative side of it and, fighting for people and fighting for the things that we need and, telling the people at Washington, this isn't good enough, because it's not. Like we need people who are fired up and, who are just sick of all the same old shit. And that's me, and I'm ready. Like, I'm ready to go, man. Like, I feel like we need real people. We need people that are down to fight and, really get amped up about the things that they believe in and, really put their passion into it. Because I feel like that matters. Mm-hmm. I mean, at the end of the day, like, no one gives a shit about where you went to college. They care about how much you care about what you're talking about.
Yeah.
They want to see how much passion you have in this moment at this time and what you are doing to fulfill that.
Well, I recommend to stop dying first. That would help so much.
It just made me so cool, though.
It does. Like, who can say they died twice?
Well, I mean, Nikki Sixx died like 6 times, so he's like way cooler than me. Like, there are rock stars that have me beat. I don't really know if I want to go for the record. I kind of would like to just. You gotta
start doing coke now.
Yeah, I mean, I wonder if there's therapeutic. Just.
Yeah.
All right, no, real talk. You're gonna laugh at me. So I have been working on a scientific theory.
Uh-oh.
Okay. So it's been really hard to figure out treatment with, like with my condition. And I discovered that nicotine helps Behçet's.
Really?
So that's been something I've been actually like experimenting with and seeing. And actually a lot of my symptoms have gone down a little bit. So I'm documenting and messing around with it and seeing, I'm doing science. Okay. I am a scientist. I am a genius scientist.
I mean, if it's anything that will help you to make you feel better, like go for it. But...
Yeah. So just looking at any kind of things, because there were so many like different reports where there were people with Behçet's who had actually, when they stopped smoking, they ended up having an influx of symptoms. Which, weirdly enough, I mean, hey, I was an EMT. If you don't think I was chain smoking for part of my career, you are wrong. So that was actually when a lot of like my stuff like kicked off. So I was like, if I try nicotine patches, is that something that might actually help? So experimenting. Expect to see a Cambridge Journal of medical excellence.
Oh, I mean, medicine can be in crazy ways. But there have been many inventions that have been discovered accidentally. I think like dynamite was one of them. So let's finish up with your music career. It's like,
oh boy.
Do I see like the next? I'm not sure who to compare you to, but how is that going for you? I know you have a song out, so.
I do. It's actually a really fun one too. I'm actually trying to potentially branch out into TikTok and start doing musical covers there, because I feel like a lot of people have actually really taken off that way. Because like I really want to bring music into my advocacy. Like, I do like being the badass. It's kind of fun. So so if I can get to do that and not only inspire people but have a good ass time doing it, like I'm gonna do it that way. So I'm thinking of branching out into TikTok. Like I used to do like, this is like back when I was like 18 and like being ridiculous. At first I was doing cover bands. I was doing a Led Zeppelin and Heart cover band. I absolutely loved it. That was like my favorite thing in the world. And then I got burned out and I joined the Navy instead because that's great for stress relief. But yeah, I love performing. I love music. I still compete every once in a while. Like I'll see like some random ass like singing competition and I'll be like, it's a Friday night. I've got nothing to do. I would like to win $500.
I'm sure you win.
Sometimes yes. Sometimes they're rigged. Or sometimes they just don't have taste. No, but no, most of the time. What I love doing though, my favorite thing to do, like this is like my all-time, like if you ever want to find me on a Friday night and don't know where I am and we're not in the middle of a pandemic, I'm probably at some random ass dive bar doing karaoke because drunk people get really excited when you can sing. They get
yeah.
really, and they're like, can you do Journey? Do Don't Stop Believing, do Freebird. I'm just like, it's the greatest thing ever. So it's like, if I ever need a pick me up and I want to feel good about myself, I just go out to karaoke night at some random bar and just have the time of my life. I guess we can call it the time of my afterlife. I don't know. But yeah, so like I try to, find ways to cause trouble and be ridiculous and just have a good time.
No, that sounds like a great time. Like I want to go now.
Right? I mean, I feel like honestly, what should happen is if there are any big patient organizations that would like to have a musical guest artist, hey, I will serenade you and I will do a good job. It'll be a party. It's a good time. Hit me up.
Yeah, so before I take the mic away from you, is there anything you want to promote or say or closing thoughts? Anything?
Nothing in particular besides
okay,
the fact that I had a good ass time being on your show. And that we should do this again. This is fun.
Yeah, but anything you want to say to finish it off?
If there's anyone listening to this who's had a similar situation where their doctors didn't believe them and they knew that there was something more to the picture, like, you're probably right. Keep going with it. You'll actually hear me talk a little bit more about that on an upcoming podcast with Patients Rising, which I'm really excited about. So that should be coming out soon. You'll see like little things kind of peppered through their social media for the next while. So you'll probably see all that good stuff too.
Okay, so thanks, Jen, for coming to the podcast. Thanks, everyone, for listening, and I'll catch you next time. Bye-bye.
Bye.